Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Sarah Sachs-Jepson, family nurse practitioner, about bacterial meningitis. Thanks for being here today, Sarah.
Sure.
Now, with graduations behind us and students on their way off to college, a disease that a lot of people are worried about is bacterial meningitis. What can you tell us about that?
Bacterial meningitis is an infection of the fluid surrounding the brain and spinal cord and affects about 4,000 people in the United States every year. Of those, about 500 people die from the illness. Meningitis is a serious disease that can lead to blood infections, hearing impairment, damage to the nervous system, mental retardation, seizures, and even loss of limbs. Although anyone can get meningitis, it's more common in college students who live in dorms, military personnel living in barracks, or other people living in close quarters, and in teenagers 15 to 19 years old. Infants under the age of 1 and people without a spleen are also at higher risk of the disease.
How is meningitis spread?
Transmission of the bacteria that causes meningitis is spread through respiratory and oral secretions. It's spread to people who have had close contact with a person who has meningitis. Anyone who comes in direct contact with someone's oral secretions or saliva would be at risk of contracting the illness. Casual contact or breathing the same air as someone with meningitis is not a likely way of spreading the bacteria.
Is there anything we can do to prevent ourselves from getting meningitis?
Since the outcomes of bacterial meningitis can be so devastating and 10% of people who contract the illness will die from it, prevention is important. There are two kinds of meningococcal vaccines available in the United States. The MCV4, which is the preferred vaccine for people ages 2 to 55 years old, and the MPSV4 that is used for people over 55. Both vaccines prevent the four most common types of meningitis found in the U.S. and that are responsible for causing epidemics in Africa.
Who should get the vaccine?
The Advisory Committee on Immunization Practices has recently updated its recommendations on vaccine schedules and recommends that the first meningitis vaccine be given at 11 years old and then a booster be given at age 16. Individuals who should receive the vaccine include previously unvaccinated college students living in dorms, military recruits, anyone traveling to or living in Africa or other meningitis-prone regions, anyone with splenic injuries or without a spleen, and people with weakened immune systems.
What should I do if I am exposed to someone who has meningitis?
Notify your provider immediately. If you've been exposed to someone with the illness and are considered to be a close contact, antibiotics can be given prophylactically to prevent you from becoming ill.
Okay, great. Good information. Thanks for being here today.
Sure.
Please join us next week for a new health topic discussion on House Calls.